interviewed teachers, healthcare workers and members of the public in 6 African countries: Ethiopia, Ghana, Kenya, Liberia, Malawi and Nigeria. Respondents were asked to share their experiences on public health and education services. 84% of teachers surveyed reported a drop in income since 2020, while 97% of health workers described their wages as insufficient to cover rent, food and household expenses. Analysts say cuts to public budgets since 2020 have slashed funding to essential services. The impact has been felt across vital sectors. In the education sector, teachers cited a shortage of essential classroom furniture and reduced access to teaching materials, while learners experienced overcrowded classrooms, shortages in staff, and educational resources which further diminished the learning environment. The majority of health workers interviewed reported a scarcity of medical equipment and supplies due to insufficient budgets. Patients complained of exorbitant doctors' fees, long waits and costly services. Aid group ActionAid, which produced the report, attributed this decline in services to under-resourcing of health and education services in the 6 African countries. This, they claim, is happening due to African governments prioritizing debt repayments, moves they say are influenced by international financial institutions. The report calls for immediate action from all stakeholders. ActionAid urges international financial institutions to stop imposing austerity measures and focus on tax reforms and debt relief or cancellation to increase government revenues for investment in public services. It further recommends that national governments seek debt relief or cancellation and expand tax revenues in fair ways to rebuild public health and education workforces and infrastructure. This, it says, is key to ensuring African governments have more funds to allocate to recruitment and resources, thereby reducing the burden on essential workers. Wilkisanyabwa, CGTN.
Now, drastic cuts to international food aid are worsening the situation of thousands of Congolese who fled the conflict in the Democratic Republic of Congo into Burundi. Aid agencies are calling for more support. CGTN's Joy Kirukijuma reports.
The Musenyi refugee site in Burundi's Rutana province was set up by the UNHCR in 2024 to host 10,000 refugees fleeing the fighting in DRC. But it's now holding double that number, largely due to the increased fighting in eastern DRC since the start of the year. This has put a huge strain on the few available resources.
The influx from the Congo, in addition to the already existing economic struggle within the country of Burundi, is becoming difficult. The international community or humanitarian community itself is stretched.
The World Food Programme says it has cut food rations in half since March. Without renewed U.S. funding, it will have to stop all assistance by November. In the meantime, the dwindling food rations have made life very difficult for the refugees.
They're living a life full of problems. It's not a fulfilling life. I'm a mother of 8. We all sleep here. Life here is not good. It's not satisfactory.
We can see additional or more girls dropping out of school or getting pregnant or getting married at a very young age so as to survive. Or even we might have even deaths as a result of hunger and lack of food, even lack of medicine and lack of health equipment or facilities or medicines within the hospitals and health facilities.
According to the UN, hundreds of Congolese are forced to return across the border in search of food, despite the risks. It's a desperate situation that aid agencies, including the WFP and the UNHCR, say needs to be addressed urgently to help ease the suffering of the refugees. Joy Kirukijuma, CGTN.